Welcome to Florida Sports Docs. My name is Mark Croy, your Tyler's Performance Institute golf fitness professional. What I want to talk to you today about is myofascial release. We're going to talk about how you can get rid of those knots. If you've got a lower back that's aching, your hips ache, maybe your knees ache, you got different types of pain, stiffness, maybe you're feeling really stiff in your golf swing and you just can't seem to loosen it up with stretching. What you tend to have are what are called myofascial restrictions or knots. You ever gone to a massage therapist, something like that? They get in there and they're digging around on those knots. That myofascial overlies the muscle, it gets agitated, and it tightens up, which changes how the joints work, the stress on the body. So using a lacrosse ball or a tennis ball and using a wall is a great way to set yourself up for some success to release that tension or pain. So what you do with the ball is you get a nice strong wall, and what you're going to do is you're going to work through this area through in here. You're going to work up through your hip, up through here. Back here, you're going to work through along your lower back, right through here. People call this their lower back. This is actually your glutes up here, all the way around into your hip. You have a bone here, your greater trochanter. What you want to do is you want to then work down around it this way, then come up into your hip this way. So what you do is you take the ball and you lean back against the wall and you put some pressure on it. You can control how much pressure you put on it by how far your feet out. If you really want to put a lot of pressure and really get into it, you put your feet out. If you want a little less pressure, can't quite tolerate that, then you're going to step up a little taller. I like to come out here, and what you want to do with this tissue, which is a good thing to do, is to roll up and down. Not a big fan of side to side. It's not nearly as effective. Not that you're going to hurt anything, but it's not as effective. So what you want to do is you want to just roll up and down on this ball. Just little tiny rolls. You don't need these great big ones. So you just roll in. Don't be afraid to shift your feet around, move your feet, turn your body, and you're going to roll. And again, you're going to leverage in. Now, if you happen to get on a spot that's really tender, maybe you can barely stand it, what you want to do is you want to stop and not hold your breath. A lot of people will hold their breath. What you want to do is breathe, let oxygen in there, and let it relax, and then hopefully it releases. If it doesn't release, then you can come off of it, stay on it as long as you can, tolerate it, then come off of it, and then just work the tissues around it. Then come back to it, put pressure on it again. Once it releases, then you can do some little rolls on it again and release that tissue and get it out of there. And then you just keep moving around here over onto your side, and you leverage in, you can just push. You get this, like I got a tender spot right here, so I just push, I'm breathing, and then after that I can roll. So you just roll with that ball and work, and you just keep turning, leveraging, and you can keep working around. Again, when you first start this, you're going to feel like a monkey on a football, but when you do this frequently and you do it long enough, you'll actually get really savvy, you'll get really good at it, and let me tell you, it is highly effective, it can really change lives. You can also work down through here into this region. It's not going to hurt anything. It's going to feel like you're rolling on bone. But again, just control the pressure, roll. The fascia overlies that, and it really helps with that lower back stiffness. Right? So once you get done rolling on this ball, you can spin as long as you want. I always have everybody ask me, rolling for 5 minutes, 10 minutes, how long do I go? It's whatever amount of time you have. And if you don't have that much time, maybe you work on one side for a little bit, take off, do whatever you need to do during your day, come back, do the other side. You can't overdo this. And another thing I want to tell you about is if you're doing this and it's sore and you get sore, ice is a great thing. As soon as you get done with it and you're a little tender, a little sore, go ahead and put some ice on it. That'll help knock some of that inflammation down. Your skin may not be used to rolling on the ball, you're not, so you need to have that avenue to go to. But this is a great pain release, myofascial release, really unstiffen you. And then when you go look back at some of my other videos where I'm talking about pelvic tilting, hip motion, middle back rotation, this is a great avenue to take to help you accomplish those and bring that movement that you need to your life. Again, I'm Mark Croy, Florida Sports Docs. Hope you enjoyed this video. Have a great day.